Hi, my name is Ashley Curtis, and I am going to be showing you today how to properly administer medication to your patient, whether you're at a hospital, at home, or like in a home care facility, any type of facility. So first off, you need to make sure that you have all of the correct supplies. So you will definitely need your physician's order because medication is not allowed to be given by a nurse unless you have a medication order from a doctor or a physician. I also will need a glass of water because my patient is going to be taking pills today, and these pills are sometimes harder to swallow. And I will also need disposable gloves. You don't need the sterile gloves, just regular disposable gloves. And make sure that you don't have the latex ones if your patient is allergic to latex. And then you will need your medication that you are giving the patient. You will need a cup to give the medication in. You'll need to make sure that you are checking the medication 3 times before you give it to the patient. So I'm going to check my physician's order, make sure that everything looks right. So the name on the patient, Haley Simmons, there's the date of birth, March 6, 1999, and it is for the 2 Flintstone gummies. And I'm going to, now that I've checked the physician's order, I'm going to check it to the MAR. Everything looks good, the right date today, and the right time. And now I'm going to check it up against the label on my medication. So I'm checking it against my label on my medication. Looks right. It says that you can take 2 for the age of the patient and that it is expired on 09/2020. And then you have to make sure that your patient actually fully chews the 2 gummies. So now after I have done this and I have poured my 2 pills in my container, I am going to bring my stuff to the patient's room. But usually you'll find that you have the gloves in the patient's room. This is just for demonstration. And I'm going to bring the medication bottle just so if the patient asks when the expiration date is, or maybe the medicine looks kind of funny to them. And if the patient ever says that the medication looks funny or is not the medication they're supposed to take, immediately stop what you're doing and go talk to the physician. So I'm going to walk to my patient's room, and at first I'm going to knock on the door and say, "Hi, this is Ashley. Can I come in?"
Yes, ma'am.
All right, so I'm coming in. I have introduced myself. I'm going to set my stuff here. Hello, my name's Ashley. I'm going to be giving you your medication today. I see that you have difficulty swallowing, and can you state your name and date of birth for me?
Haley Simmons, March 6, 1999.
All right. Can I have you sit up for me because we're going to be giving you some pills. Is that okay?
Yes, ma'am.
I see you have difficulty swallowing. So when you have a patient that has difficulty swallowing, you will need to help them in ways like you'll have to get them a glass of water to make sure that it'll help them swallow. You also have to put the pill at the back, as far back on the tongue as you can without making them gag. So I've performed my hand hygiene. Now I'm going to put my gloves on. And as you know, I have already performed my 2 checks. This will be my 3rd check at the bedside of the patient. So I'm checking the medication again with my physician's order and my MAR. Everything looks correct to me. All right, so I have my medication. I have my water. So Miss Simmons, can I have you open your mouth for me? All right, here is the water. You will dispose of your cup in the trash. We'll put this on the bedside table. Can I have you open your mouth just to make sure that it all went down? Very nice. All right, so after I finish this, I will let the patient know about that I'm going to check on her in at least 30 minutes to make sure that there's no funny effects. If you have anything wrong, just make sure you hit this call button for me. All right, and I am going to take off my gloves. You'll make sure to take them off correctly, even though you may not have came into contact with any body fluids. I'm going to throw them in the trash. I'm going to perform my hand hygiene. So, Miss Simmons, can you lay back for me?
Yes, ma'am.
Are you feeling okay?
Yes, ma'am.
All right, so I'm just going to step over here, and I'm just going to write out how everything went, okay?
Okay.
And when you document, so I'm stepping over here to my computer. When you document, you make sure that you put what happened, how well the patient took the medication, and any vital signs that you've previously taken when you were giving the medication. if you're getting a blood pressure medicine, you'll make sure to take the blood pressure. So I'm tapping in my documents, and I'm going to leave. So Miss Simmons, just make sure you press the call out if you need me, okay?
All right, thank you.